folks, and welcome to the Virtual Psychiatrist. Welcome to our co-host, Dr. Christopher Russo. When we talk about bias in the justice system, it's so often wrapped in layers of complexity. But, Chris, this case with Dr. Neil Anand, it's practically shouting at us, isn't it? Weaponized AI, distorted data. The Rat King, how do we even begin to dissect this?
Exactly. The Anand case is uncharted territory. Imagine sifting through years of patient records using an algorithm that cherry picks outliers. It builds a narrative, but not necessarily a truthful one. The AI sees patterns, but it doesn't ask why those patterns exist.
Right. And Chris, the idea of painting a compassionate doctor as a criminal because of an algorithm, a piece of code without context, without humanity, it baffles me. How do we reconcile that with the Hippocratic Oath?
Exactly. And it's worse when you think about the so-called expert witnesses like Dr. Timothy King. Here's someone who's paid exorbitantly to testify with blatant bias in favor of prosecution. His interpretations, his courtroom science, often border on fiction, and the system just runs with it. Last week, we witnessed some seismic shifts in the first 3 days of the trial. It was a doozy. We were there, Dr. Refi.
Fiction, yes. It's almost dystopian, Chris. A single person armed with selective facts dictating narratives that ruin careers and lives. And when we layer AI on top of that, it amplifies systemic inequities, especially for minority healthcare providers already facing disproportional scrutiny.
It's horrifying. These providers are already under immense pressure, and now algorithms are being weaponized against them. It's like being caught in a machine that's designed to find guilt, no matter what. Dr. Anand's case is case in point. The deck was stacked before the trial even started.
And did you notice, Chris, how the AI itself is based on flawed historical data? It punishes compassion because it doesn't distinguish between tailored care and misconduct. A patient's humanity gets reduced to risk variables.
Exactly. Humanity's the missing link in all of this. Even the way they use red flags like MME, morphine milligram equivalents, as if they're hard lines rather than guidelines. It's arbitrary and dangerous.
And then there's Dr. King, who champions these flawed metrics. His voice in courtrooms carries weight, not because it's right, but because it's convenient for prosecutors. And we've seen this before, how his biased testimony shuts down nuanced truths. But boy, did he meet his nemesis in Dr. Anand's defense team. They will chew him out when he comes back in a couple of weeks.
Speaking of shutting down, remember when the defense for Dr. Anand countered with evidence of his meticulous care? Playing those full, unedited videos exposed the truth. They weren't pill mill practices, they were textbook precision, but that only happened because they pushed back hard enough.
Exactly. And that makes me wonder how many others didn't push hard enough, or perhaps couldn't. This fight, it's more than Neil Anand's. It's about reclaiming humanity in medicine and, honestly, in justice itself. But Chris,
Hey, Refi, picking up on what you said about humanity being stripped away, Dr. Anand's attention to detail really shines here. Opioid agreements, thorough patient evaluations, regular drug tests, these safeguards reflect meticulous care. So, how does a system turn doing everything right into something so wrong?
it's a twisted irony, Chris. He wasn't just managing pain, he was managing risk for his patients, for his practice. Yet the same measures designed to uphold safety were reframed as evidence of liability. It's as if compassion itself was put on trial.
Exactly. The opioid contracts implemented by Dr. Anand were meticulous. Patients had boundaries. They understood the risks, signed agreements, and underwent routine evaluations. But the prosecution didn't see care, they saw control.
And this isn't an isolated story. Look at history, how healthcare providers, especially those in minority communities, have faced disproportionate accusations. Chris, I can't help but think back to my own experience. The stigma, the misjudgment, it's pervasive. It wears you down.
It really does. And that's part of this systemic issue. When physicians go beyond the minimum standard of care, thinking they're protecting themselves, they're actually giving prosecutors more to dissect, more to misconstrue.
Right. And what these cases often lack is empathy. Take Anand's treatment approaches, diagnostic imaging, nerve blocks, personalized plans. These require trust between doctor and patient. But algorithms, government experts, they dismantle that trust for the sake of an easy conviction.
And the impact runs deeper than the courtroom. It silences doctors everywhere. How many providers are pulling back from managing chronic pain because they fear the same fate? Annan's case sends one clear signal: compassion is dangerous in medicine today. Look at what happened to me in the Bothra case.
That's the harm. Chris, the ripple effect. Communities lose access to care. Providers lose their passion for healing. And ultimately, patients suffer the most. Do you remember the testimony from Anand's defense? Those unedited videos? They were a masterclass in patient centered care, not malpractice.
Exactly. They showed physicians reviewing files, engaging with patients, completely professional. Yet, all it took was selectively edited clips to smear him as a criminal. That's the kind of systemic failure we're grappling with.
Failure indeed. This isn't just about medicine, it's about values. When systems trade human stories for statistics, we lose sight of why healthcare exists. To heal. Neil Anand fought back, but how many don't even get the chance?
Unfortunately, too many. And that's the bitter truth. The line between compassion and criminalization is so blurred. For every Anand, there are countless others just crushed by the system's weight. And for what? Misguided justice?
Chris, as we reflect on the systemic failures we've just discussed, one aspect haunts me the most: how technology, something meant to empower and support healthcare, has been twisted into yet another tool of bias and persecution. Dr. Annan's case lays this bare. AI, rather than being a partner in care, became a prosecutor's ally against compassion.
Absolutely. The AI used here, it's not just a tool, Muhammad. It's almost a prosecutor in itself. It scans for anomalies, but anomalies aren't the same as errors. They're just deviations from the norm. And in something as nuanced as medicine, deviations often save lives.
That's the irony, isn't it? An algorithm lacks the capacity for empathy. It doesn't care if Dr. Anand tailored his care to each patient or if he invested extra time to ensure safety. And yet, we hand over decisions of guilt or innocence to something that doesn't understand pain, compassion, or even intent.
It's frightening, really. And let's not forget the DEA's tactics, too. The entrapment methods we've seen in cases like the Detroit Five. They're creating crimes instead of solving them. Dr. Anand was scrutinized not because of what he did, but because his careful practices provided more ammunition for their algorithms and experts.
Chris, if I may, this isn't just about Anand or the Detroit Five. It's about what these cases represent. They tell providers, if you care too much, if you do too much, if you stand out too much, you become a target. For those in minority communities, this message amplifies tenfold.
You're exactly right. And the societal cost? It's enormous. Chronic pain patients are being left untreated because doctors are justifiably afraid. Access to compassionate care is shrinking. The fallout of these prosecutions isn't just scars on individual doctors, it's entire communities slipping through the cracks.
And yet, systems like these continue unchallenged because reform is often drowned in politics and profit. Justice, healthcare, technology, they're at a crossroads. Unless we advocate for better checks and balances, we risk creating a medical desert where compassion is criminalized and algorithms dictate care.
So, where do we go from here? Is it about policy changes, Mohammed? Or is it about reshaping public perception? If the system is this tangled, what's the real path forward?
It's both, I think. Advocacy must happen on multiple fronts: policies to protect physicians, public education to destigmatize pain management, and honestly, accountability for these so called experts and the algorithms backing their testimony. Every stakeholder involved needs to realize the weight of their actions.
And it starts with conversations like these. Stories like Anand's expose the cracks, but they also inspire change. We're not powerless. We can shift the narrative, but we have to stay loud and, more importantly, stay united.
Exactly, Chris. If there's one takeaway from Anand's story, it's this: justice must serve humanity, not systems. And that's not just an ideal, it's a responsibility. On that note, thank you, Chris, for diving deep into this with me. And to our listeners, stay informed, stay engaged. We'll see you next time.